cut off. Doctor, I'm going to turn it over to you. This is the good Dr. Rabinowitz. I'm going to make you the host, Doctor. I'm going to keep everybody muted. That way there's no, weird noises emanating. If you have any questions, type it into the chat, and the good doctor can unmute you, or he could ask you. He could unmute you later, and we'll do questions. But for the most part, we'll have you muted. So hopefully you don't have anything too insightful to say. And I will, everybody, and good doctor, let me make you the host. Give me a moment. And if anybody, there's more people coming in. Justin, if anybody else comes in, feel free to let them in.
Perfect. I can do that.
LaBush, welcome, David. Semiramis, hello. Hey, Kiki. All right, doctor, they're all yours.
Perfect. How's everybody doing today? Thumbs up? Good? Everyone's good? It's a nice day. I hope we get outside either before or after this. So like Rob said, my name is Dr. Justin Rabinowitz. I'm founder of Strive to Move. We have locations in Warren and Berkeley Heights. And friend of the program, right, Rob?
Friend of the program.
So last week we did a little bit of mobility, and today Rob and I were talking about doing a little bit more core. What I like about these kind of seminar workshops is what I try to do during these is make the coaching cues that Coach Rob or any of the other coaches that you guys work with, I like to make them more relevant, because what we find is that oftentimes when you have good coaching like you do get at Game Changers, that they're often giving you the exact right cues that you need, but in the course of a workout, in the course of sweating, in the course of getting fatigued, we can't always implement them exactly how we need to. And so what I want to do today is hopefully connect the dots for you a little bit. So if someone says, hey, use your core, what the heck does it actually mean? How do we actually do that? If someone says flatten your back, well, what does that actually mean? If someone says how to get into a neutral position, what does that actually mean? How do we do that? So we're going to talk through a lot of it. We're going to do a little bit of exercise. If you're not ready, or you're just going to hang out, that's fine too. Whatever, it's your world. We're just living in it. So whatever you want to do, if you want to participate, you can. If you don't have to. Just to kind of give you guys a little bit of background of why we're doing this. One of the most common complaints that we see in our office is often that I don't understand. I thought my core was strong. I can hold a plank for 2 minutes. I can do sit-ups. I can do all these exercises. What do you mean my core is not working? The problem that we see most often is that people fail to connect the dots. And what does that mean? That means that that plank that you did, that's great. It's good for your core. My question becomes, are you utilizing your core, and are you being stable enough when you need to, i.e. when you're going to squat with a weight in your hand, when you're going to deadlift, when you're going to pick up a laundry basket. Any of those things that you're doing in the gym or around your house, that's the time that you really need to utilize your core. And so if we're not aware of how to kind of maneuver ourselves, engage our core, create a neutral spine, all these different things, if we don't understand how to do this, eventually we're going to have a problem, right? So think about it like this. So our spine, everybody knows, is right here. And the spine is just a series of joints and bones that stack on top of one another. Surrounding the spine, we have back muscles. Other than those back muscles, the only other thing you have to support your spine is on the front, okay? So if we want to save our lower backs, if we want to spare our spine from having an injury, we have to do everything we can to make sure that all of the muscles that surround it are working as well as they possibly can be, or else we're at risk for injury. With a lot of people that we see at our practice, we get the people that have gone to PT or gone to the chiropractor or gone to acupuncture, and that hasn't worked for them, right? And what we often find is that they were getting the massage or they were getting the treatment and it was temporary relief, but eventually their pain would come back. And what that tells us is that potentially the massage or the stretching, it was good at the time, but but it wasn't the long-term solution. There has to be something going on that causes us to keep recurring and recurring and recurring. And that's when we start looking into how is your core functioning? How are you actually doing your lifts? For all of you here today, you're working out, you're at the gym, so you're doing the movement. The question becomes, are you doing these movements that are optimal for your body? Okay, so if everyone's okay with it, what we're going to do is we're going to start off, we're going to lay on our backs. And what I want you to do is lay on your back. And if you are seated and you don't want to get on your back, I'll show you a version there too. What I want you to do is lay on your back, and you're going to flatten your back out and bend your knees if you can. And from there, once you flatten your back and you bend your knees, what I want you to do is put your hands at your side, and I want you to lift your knees and feet to 90 degrees. So just like this. So when you're in that position, what I want you to do, I want you to try and put your hands underneath your lower backs. You should not be able to slide your hand underneath your lower back. That right there is a neutral back position. Okay, now everyone let their legs down and relax them. Good. Now I want you to try to take your hand and slide it underneath your lower back. There should be a little bit of an arch there. That's losing the neutral position. Okay, that's losing the neutral position. So let's do it again. Keep your hands underneath your lower back and lift your knees and feet off the ground. You should all feel putting pressure onto your lower back and your hands, and you should feel the core start to engage. If this position feels weird to you, like you've never done that, or you feel abs in a way you haven't felt before, this potentially is a reason why you have a problem squatting or deadlifting. This should feel normal to you. Good, go ahead and relax. Now, I want everyone to poke themselves in the belly. So you're laying on your back with your feet on the ground and you're poking yourself in the belly. When you go to lift your knees and feet off the ground, what you'll feel is that your belly gets tight. You feel your abs engage. So now let's do that a few times. So lower your feet and then raise your feet. Lower your feet and then raise your feet. And if you're poking yourself kind of in the belly near the belly button, what you should feel is that your kind of core turns off and then your core turns on. And then your core turns off and then your core turns on. Just do about 10 of these. If this hurts your lower back, that's an indication that when you try to use your core, your back is taking over. That gives us information that we might need to fix. If you feel like your hip flexors are working overtime, that gives us information that maybe you're doing too much with your hips and not enough with your core. You should only feel your core working and in this position. Let's do a few more reps. Feet down and feet up. So what you feel, your abs are off, your abs turn on. Your abs turn off, your abs turn on. Again, this should only be working your core. Good, take a break. Cool, everybody sit up. Excellent job. Give me a thumbs up if you felt your core working. Good. Give me a thumbs down if you felt your lower back working. Okay, again, let's think about that. What's going on? If we're laying on our backs, we're not tired, we're not doing an involved exercise, we're not lifting weights, and we feel like our low back takes over as soon as we get our core going, again, that's an indication that potentially we have something that needs to get fixed. Most of you did a good job, but let's create some awareness around where the problem might be. What I always tell people is I would much rather us figure that out doing this than in the middle of a set of 8 deadlifts when you're fatigued, when the stakes are higher, when the weights are heavier, when everything is at a much more challenging position. If we figure it out here, potentially we can save you from that serious, serious injury down the line. Okay, now we did this last week, I believe. We're gonna repeat it for those that weren't here. For those that were, hopefully it's a great review for you. We're gonna go hands and knees in a quadruped position. And if you guys have done yoga in the past, you've probably seen a cow or a cat-cow. And let's just do a cat-cow. So let's just do about 10, where you're gonna round your back all the way, and then you're gonna extend your back all the way, and then you're gonna round, and then extend, and then round, and extend, and round, and extend. Thumbs up if that feels like a stretch. Good. Thumbs down if it feels like you have pain in your back. Good. No pain in the back. That shouldn't feel like a pain. It should feel like a stretch. Okay, now we're going to do 3 movements here. I'll show you. We're going to round our back. We're going to extend our back, and then we're going to go halfway in between. So round your back, extend your back, halfway in between. What you just found was a neutral spine. When you go halfway in between, you should feel your abs a little bit. Your abs are turned on a little bit. Very similar to the position you just were in your back, when you were on your back. Now, so watch me. You've gone round, extend, neutral. Core is engaged. Now from here, we're gonna sit our hips back. So if you need to widen your knees, you can. While you're sitting your hips back, you need to keep your core engaged. So if I was in your house or Coach Rob was and we were poking you in the belly, it should be hard. It shouldn't be soft. Make sure you're maintaining that core the whole time. The problem that most people have is that they'll get their core started, and as soon as they start moving, their core stops working. And that's the equivalent of you guys starting your car with air in your tires. You get on Route 78 and the air comes out of the tires. This is the same problem that we have when we're working out. If you're losing that pressure in your core, you're putting your back at risk. So we need to get into that neutral spine. We need to get our core engaged, and then we need to start moving our way through it. Perfect. Good. Take a break. Does everyone feel their abs working? Give me a thumbs up. Yeah? Is that a different, is that something that's normal to you? Is that good, or you haven't done that before? You've done that. Good. Good. Anybody have an issue with that? No, it was good. Perfect. Okay. Now, here's what we're going to do. This, I think, potentially could be the most useful piece of this. We did 2 basic things. Now we're going to stand up on our feet. Now we're going to try to connect the dots. Here's where I think a lot of people get in trouble. It's that they do their core exercise, they do their warm-ups, they do their core activation, but then they go to exercise and they lose it all. So let's do this. I want everyone to stand up. We're going to work on our deadlifting, hip hinging. Rob, do you guys have any other names for it? Deadlifting, hip hinging? You're on mute. Rob?
I'm sorry about that. We'll call it, when it's body weight, sometimes we'll call it a good morning.
Okay, good.
Romanian deadlift, you know.
So Romanian deadlift, good morning, any of that jazz. I'm going to tuck my shirt in so you guys can see this. All right, so remember all the stuff that we just did, neutral spine, core, all that jazz, okay? So we're going to do good mornings or Romanian deadlift, whatever we want to call it. What I want you all to do is I want you to take your hands around your waist, and I want you to poke yourself really hard. Once you poke yourself really hard with your fingers, I want you to take your abs, and I'll show you, and push out. So you push in and then push your abs out. Okay, so now if I came and punched you in the stomach, it would be tight. Okay, let me just let someone else in here. All right, so now you feel that tightness? Good. Maintain that tightness, and let's do a good morning. Don't lose that tightness. Stand straight up. When you get to the top, you can relax, but before you go to do it again, get that tightness again. And then come back up. Engage your core, get tight, do your good morning. At the bottom, make sure you're tight and come back up. Make sure you're poking yourself. Poke yourself in the belly and push your belly out into your fingers. Keep that tension, keep that tightness. Where most people will have a problem is they'll start well, they'll push hard, and then as they go down, once they get to here, gone. Right? They've lost all the pressure in the tire. Their tire is out of air. We need to maintain that pressure. If this is too much or this is hard, this is something to work on. Remember, we add fatigue, we add reps, it gets more challenging, not easier. Couple more. 1, 2, 3. Good. How does that feel? Does anybody feel different when they do that? Does that feel good? We sometimes do this with people, and what happens is they'll walk in with back pain, and then potentially they start activating their core, and their back pain decreases or even goes away because we've used their core appropriately to kind of support and stabilize themselves. All right, now we're going to do a body weight squat. The rules don't change, it's just a different exercise, okay? So we're going to do the same thing. Put the feet in a position you're comfortable with, shoulder width or a little wider, turn them out if you need to. We're going to push in with our hands. We're going to push our belly out. Hold that, squat down, stand up, maintain that pressure. Squat down, stand up, maintain that pressure. Keep going. Keep going. Good. So I can tell you, I just got off 3 calls with patients doing virtual sessions, all with back pain, all who were working out, all who were just doing the exercises incorrectly. We spend 15, 20 minutes just doing this type of stuff, just making sure that their core is working when they're exercising. I always tell people I don't change the exercises. I don't create anything fancy. It's not magic. It's getting you to be able to use what you've already got even better. And here's the thing. So has anyone ever used a weightlifting belt or seen a weightlifting belt before? Most people think that a weightlifting belt is there to kind of suck you in and pull everything together. In fact, what the weightlifting belt does is it sucks you in so that you can push your belly out into it. We're trying to just create the same sensation by ourselves without the weightlifting belt. So now let's get you comfortable with this, because most likely you're going to get off this and be like, I don't remember anything you said. So let's repeat this. Like, again, what I'm saying today, most importantly, is we're not going to do a ton of stuff, because if we can get this and you do this well, this will help you so much more than doing 30 different ab exercises. So let's go back to our deadlift. Hip hinge. Push into your belly. Push your belly out into your fingers. And let's do a set of 10. The key thing here that I'm most concerned with is as you start to bend over and hinge, at that bottom position, are you maintaining that pressure? If you're maintaining that pressure, you've got a shot to keep your back in a good position. Hey, Kim, just unlock your knees a little bit. Yep, perfect. Good job. That's a good correction. Perfect. Good. Good. Yeah, you guys look really good. 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 Diana, you could bend your knees a little too. Just unlock them a little bit. Yep, good. And sit back. Good. Perfect. Excellent. Good. Now let's go into our air squats. Same thing. Same thing. Perfect. Good. Let's just do 7 or 8 of these. Give me some abs. Give me some core. Excellent. Really good. Awesome job. Okay, cool. Now, I want to do potentially 1 or 2 more exercises with the same thing. Does anybody have, let's open it up for questions before we do anything. Rob, do you have any specific questions? Again, like I said, I would, if you guys left here with nothing more than doing that or understanding that, that would be more than enough. What I often tell people when I start working with them is that in the beginning, it seems overwhelming. It seems like there's a lot of things to think about. It seems like I'm never going to remember this. There's so many pieces of it. But what actually happens is that people realize that it's actually just 1 or 2 things just put into different exercises, right? So whether we're squatting or deadlifting, we're going to cue it the same. If I'm shoulder pressing, we're going to do it the same. If we are bending forward, we're going to do it the same. Okay, we have a question in the chat. MW, I'm confused. I thought engaging your core. Good question. This is a good question. So it says, I thought engaging your core was pulling in your stomach. This seems like pushing your stomach out to engage. How many people, raise your hand if you thought that engaging your core was pulling your stomach in? Good, we see that a lot. All right, so it's a great question. I'm glad you asked it. So let's talk about that for a second. If you guys want to chime in, you can unmute yourself or talk about it. So typically in yoga and Pilates, they teach that we want to kind of suck our core in to engage our abs. And so I believe there's a time and place for that. It's not wrong. However, when you are lifting weights, and again, Coach Rob is a former power lifter, if you're cueing yourself when you're lifting weights, Rob, are we going to feel like we're expanding our core or sucking our core in?
I expand it and I get my belly as big as possible, knowing that it's only temporary. It's not going to make me big.
Right? But so that's the thing. People are like, wait, you want me to push my belly out? Sort of, but not really. I don't want you guys just to puff air out into your stomach. What I want to do is activate your core. So it's like if any of you have ever had a coughing or a sneezing fit and your abs get sore, that's actually kind of the sensation we want to do long term. So think about this for a sec. Yes, we will go through that as well. We'll go through core progressions and regressions. Think about this for a second with your core. If I asked you how to make a muscle stronger, would you want to make the muscle bigger or would you want to make the muscle smaller? If I wanted to make a muscle stronger, I would want to make the muscle bigger. The same thing applies for the abdominals. If I suck my abs in and squeeze them, I'm making my abdominals smaller, less surface area. If I want them to be more stronger, I want my abdominals to expand. So again, think about the example of the weightlifting belt. We've all seen powerlifters that wear a weightlifting belt, and the false belief is that the weightlifting belt sucks you in and that supports your back. The weightlifting belt is just a mechanism to give you pressure so that you push out into it, so that you push your abs out into it. And so when you're working out, when you're lifting weights, we actually want to expand a little bit. We call it intra-abdominal pressure as opposed to contracting. The easiest example, we want to create something that looks like this at our center. Rather, we don't want that. We want to create a nice, we call it like a robust center where we have good pressure and we have a nice roundness here where we're using all of our abdominal muscles in the front, back, and sides. So really good question. Does anyone have any follow-up questions to that? Because that's a huge point. Does that make sense to everyone? Thumbs up. Does it pay to wear a belt? Pat, good question. So what we say with a lifting belt, and again, Coach Rob could speak to this even better than I can, is what we say with a lifting belt is they have their time and place, but the place is usually only when you're at 80 to 90 to 100% of your 1 rep max. Meaning like if you're lifting really, really heavy weights a lot, that's the time to use them. The problem with wearing them all the time is that it creates a false sense of stability, and a lot of people stop using their core in the way that we want them to. So for most of us in the training environment that we are in, I would recommend not wearing it. I would recommend creating your own belt, as we just talked about here. So there's a coach, Rob, do you agree with that? I don't want to say.
Yeah, I would agree with that. It's only if you're lifting like super heavy because you want to, eliminate really all risk, and it's giving you that feedback to make sure that you're turning on your core. You don't want to be overly reliant on it, and then you're doing even small tasks, and you're not getting that feedback from the belt, so you don't work your core. So for us, I don't recommend it.
Cool. Does that answer your question, Pat? Excellent. All right, now we're going to go back to that first position that we did, that dead bug position where we're going to be on our backs, and we're going to go through some progressions here. More importantly than the progressions is I want you guys to understand if you're in a position that you can progress yourself. And so why is this important? Because some of these movements are so small that when you're being coached, oftentimes they might look okay, but they might not actually feel okay. So just watch before we do anything. The first thing we're going to do is get on our back with our back flat. Then we're going to lift our feet off the ground. Now we can lift our arms up off the ground, and we're in this position. Now remember, the key here is that our back stays flat. Any sort of movement we do with our arms and legs is challenging that. Your only job is to make sure that whether you move your legs or you move your arms, that your back continues to stay flat. So if you've kind of done this before and you felt your hip popping, that means your back isn't staying flat. So let's try this. Everyone go into position. Your arms and legs are up, and all you're going to do is work both arms overhead. Now, if you feel like you get to a point where you feel your back arching, you stop. Again, this is how you guys can start to help yourselves and understand the position. So you're in the air, your back is flat, and again, if I was over there and I put my hand underneath your back, you should lose no pressure. So you are only allowed to lift your arms as far as you can keep that pressure and keep that back pinched into the ground. Another example that I would think about is if I had to roll a towel underneath your arm, underneath your lower back, and I tried to pull it out, I should not be able to. Good. Now I see some people doing it already. Let's add the legs to this. So we're going to not move our arms, and we're just going to move one leg at a time. Now, I would say this is the most screwed up exercise that I see. A lot of people do this wrong. They do it too fast. Their back starts to arch. Their back starts to come off the ground. That back has to be absolutely plastered into the ground. If you feel your lower back working, if you feel your hip flexors working, you're doing it wrong. Your abs should be fully engaged throughout this whole process. And again, you get no medal for doing a lot of these fast. This is about stability. This is about control. I'd rather you do 3 good reps than 10 mediocre to bad reps. Good, take a break. So again, assess the areas here because I want you to know you guys all look phenomenal. It looks great. The next step to this is what you should feel. Okay, so if you feel your thighs or your quads working, probably not the best. I would take a break. I want my abs to be working. If you feel your lower back working, definitely not correct. Because again, you guys all look perfect. It looks perfect. But I want you to know what you should be feeling. All right, now, was that you waving, Rob?
Yep, I have a question.
Yes.
If somebody has a bigger natural anterior pelvic tilt, like if somebody has more of a natural arch, will this be harder for them? Will they not be able to do as advanced of like a progression?
It'll be harder and they need it more.
Gotcha.
They need to do it more. Like I said, the patient I had at 10 o'clock this morning, her chronic pain is due to the fact that she's so arched forward that her low back is always working. And we have to spend our entire session putting her in the right position over and over and over and over again so she understands and gets there more consistently. I'm one of those people that, generally speaking, I walk or my hips kind of go forward this way. So I'm always working on getting myself back into this position. So I'm one of those who has that forward tilt where this exercise will be harder and you probably need to do it even more. So now let's do the third progression and probably what you guys have done in the past, opposite arm and opposite leg. However, again, doing it with a little bit more thought behind it in that your back's got to be plastered into the ground as far as it can go. If you're doing it and it hurts, it's probably not the best exercise for you. Try to keep your back flat. Let's not feel it in our thighs. You guys look great.
Justin.
Yes, sir.
I know for some people, they have trouble getting rid of that big arch, and they'll flex their neck or flex their upper back, pick their head off the ground.
Yep.
Is that something that somebody should consider, or is that not worth the neck issues that you could get with that?
So what I would prefer in that situation is to put some sort of pad underneath your head.
Okay.
Because I'd rather you create that position without using your neck to do it.
Gotcha.
So if that feels like someone there, I'm okay with you propping yourself up on a pillow, on something.
Mm-hmm.
I don't mind that. If you have to be here and support your head and neck, I would rather you do this than do this and then head and neck up in the air. Because then most likely what's happening is you're using your neck to do an ab exercise. That's another thing too. We didn't mention that. If you are doing this exercise and you feel your neck straining, probably not the right exercise, or you're not doing it correctly. So I would make sure that that isn't a thing. What other questions do you guys have? What can I answer for you specifically to this technique? And if you guys have specific injury questions, I'll answer them after at the end. But if there's general questions on like what we're doing here and technique wise and things that'll be useful for the group, I'd like to answer those first. And what about you, Rob? What questions do you normally get here?
I guess I'd have another question. I know a lot of people will have trouble like feeling a dead bug, even if they're doing it slowly, and even if it seems like their core is locked down and they're not feeling it in their back. You know, a lot of people are used to doing like crunches and like spinal flexion stuff so they could feel it more.
Yeah. Maybe
this is too vague of a question, but to what degree should somebody really feel it in their core to know that it's tough enough and that it's doing its job?
So, you know, again, I think that also it's important to understand what like feels like we're working out for this versus feels like what's actually happening, right? Because we battle that all the time. You know, if someone only feels like they're getting a core workout when they do 100 sit-ups, you know, that's a lot of times isn't a physical thing. It's just that mentally it works for them. So we have to make sure that we're working out and feeling the right things for the right reasons. What I would say is more so than feeling it in your core. A lot of times what you don't want to do is make sure you're not feeling it in those other spots. And so what I would do if you don't feel the dead bug's working or it's too advanced is basically what I'll do with patients a lot of times, I'll put them into this position and just have them hold it until they get tired. And once they get tired, I want to know where. If they get tired in their quads, well, I know their quads are probably taking over. If they get tired in the lower back, that probably means their low back takes over. If they get tired in their core, good, that's what's supposed to happen. And so, again, remember, we don't just test things as in 5-second increments. Think about how long a workout is. So fatigue is a real thing. So if you're not sure if you're feeling it, just maybe do this exercise, hold it until you start to shake. Eventually, something's going to get tired. What's getting tired? That's a really good indication of what's actually working. So I'm much more concerned with that. Just some other kind of tips real quick. If you don't feel it, potentially one of the easy corrections to kind of think about is taking your knees and thinking like you're lifting them to the ceiling. So watch how I'm here and then I just do this little bit of like this, all of a sudden my lower abs are shaking. So that little like knee lift, I'm automatically feeling it more than I was when my legs were here. So just that little bit of shift. You'll feel it in your lower abs and your core, sometimes a little bit more. And some people might need to do that a little bit. Does that make sense? What other questions do you guys have? Yeah, Kim, that looks great, actually.
Pat, did you have a question?
Pat.
Unmute Pat. Pat's iPad.
Yeah.
Hi, Pat. You're unmuted.
I sent it. Maybe you didn't get it.
Wait.
I said when you're doing the dead bugs,
Yes.
blowing out your stomach, like making your stomach stick out as your leg goes down.
So good question. When you're in that dead bug position, actually your stomach will automatically do what it's supposed to do. Remember in the beginning when we had your feet on the ground and you were pushing and then you lifted them up and saw what happened?
Yeah.
That's what should happen all the time, right? And so when you do a dead bug, naturally the right things will take over and do what they're supposed to do. The problem that we have that I see is that when you go to deadlift and squat, that same thing doesn't happen automatically and you have to create it, right? So that same feeling of when you lifted your feet off the ground, that there was that little like engagement, you felt like your abs turn on. When you deadlift, that doesn't automatically happen and we have to create that. So my intention, hopefully, is, Pat, when you were doing the dead bug and you felt your abs engaging, almost to take a mental snapshot of what that felt like in your core. And then when you go and stand up, it's like, okay, I remember what this should feel like, and now I can do my weightlifting. So
How come my hamstrings were hurting behind my right leg when I do that? Good morning.
Only one side?
Yeah, only one side, yeah.
Well, potentially we have some sort of, again, imbalance going on where there's a compensation when you're squatting or deadlifting, you're shifting to one side versus the other. That often happens. So one of the things that we talk about is making sure that you're pelvis position is good, and making sure that if we're doing any single leg exercises, that we are taking into account of, does it feel the same on both sides, right? So if Pat, if we went for a walk today and you came back and your right hip was sore and your left hip wasn't,
That's happening.
that's not good. Well, I just walked with the same thing on both sides. So, you know, I tell people a lot, single-sided soreness after doing like a double leg activity, that's an indication that there's something going on, is an imbalance. So definitely pay attention to that, because we don't like that.
When you do dead bugs, do your heels hit the ground?
No.
I didn't think.
If so, some of you guys were going all the way. Again, no one gets a medal for bringing their foot to the ground. Most people, in my opinion, do a dead bug way too far, and they lose their core. I'll tell you exactly how I do a dead bug where I lose it. I'm here, and I'm just going to I'm going to here.
Oh.
And more than that, I know that I start to arch even a little bit. So I'm working just in this small pattern because that's what I want to feel, and anything more than that, I'm going to lose it. So again, you don't get extra credit for going all the way to the ground. You get extra credit for feeling what you're supposed to feel.
Okay.
Does that make sense?
Yep.
Gary, do you have a question?
Rachel,
yeah.
hi Rachel.
How are you? When I do the dead bug, watch it. When I do the dead bug, I feel a click in my spine. Is that all right?
No.
Okay.
What's happening is there's some movement going on in your spine that shouldn't be, right? And so I would kind of do what I just did, where you're working in the smallest range of motion you have to, where there's no clicking going on. Potentially clicking for you is a good indication that we shouldn't be going as far because there's something happening that shouldn't, right? So I would literally, you might just start here and hang out here for a while. And then if you can move this much and there's no clicking, I would just do that. And over the course of days, weeks, month, whatever, you should be able to progress it forward. But no, there shouldn't be any clicking. No hip clicking, no back clicking, no clicking anywhere. We don't like clicks.
Okay.
We don't like the clicks CLIQUE either, Gary, okay? It goes for everybody too.
But Rob, just so you know, I like to be in a click.
Rob, does that make sense?
Yeah, it makes sense.
Rob told me to do it until it hurts.
Perfect. That's great advice. That's what I call job security, right? All right. David, you wrote in. Oh yeah, it's strange working out without Rob barking. He's talking smack, Rob. David, you had a sweet background when we started, and then it changed to regular. What happened?
The bush.
You know, it made it a little difficult to see everything that was going on, you know?
Yeah, it looked like you were in like a hotel or something. It was pretty sweet. Does anybody have any other questions? Oh, Mark, that's a nice, I like that. That's sweet. There you go. Oh, yep. David's got a sweet background. That's good. I love it. All right, anybody, what other questions do you guys have? Anybody? If you need me to unmute anybody? Yeah,
Lisa and then Deb. So Lisa first. I got you.
Lisa, hi.
Can you hear me?
I can hear you.
So I have a question about core engagement before you start like a rotational sport like golf or tennis.
Yep. Yes.
Like what would you do to
I would do these.
So
there's a are you a golfer or tennis player or both?
Both.
Oh, we need to hang out. I love it. All right. So there's a guy on the PGA Tour, his name is John Rahm, and if you email me after, I can send you the link. He put out a video of basically his warm-up before a round of golf, and I'll show you quickly what it was. It was basically dead bugs. It was some core rotations. It was some, you guys know, some single leg deadlifting. It was some double leg hinging, all the stuff that you know how to do, but he does those 5 or 6 exercises in a warm-up all to get the core working, and then he'll go into his movement and rotation. So now the other question that I have for my golfers is, because most of them aren't going to get on the ground before they play. Ideally you could, but most of them are just getting to the range and just kind of hopefully taking a couple practice swings. If that's the case, Then what I would do is go into some exercises. I would go into some stuff, the basic hip hinging with some core engagement. I would go into some hip hinging with some rotations like I'm playing in my golf swing. I would go into some single leg deadlifting or hinging. All of those type of things are great ways to add stability and rotation at the same time. And again, shoot me an email after, just because I have on my YouTube channel for our business, we work at Fiddler's Elbow, and we have a whole page of exercise progressions and regressions for our golf community there. So there's a slew of stuff on there that you could find and utilize. That I have like a 2-minute golf warm-up. I have full classes that I've taught with these guys before. So it's a pretty neat resource that we have out there. So certainly shoot me a message and I can get all that info to you.
Okay. Rob, do you have his email?
I certainly do.
Thank you.
We'll also type it. I'll type it into the chat as well.
Okay.
Yeah. So our business is Strive, the number 2 Move. So we're on social media all over. So you can find us there as well.
Deborah, did you have a question?
It's my email. I just put it into the chat.
Hold on, Deb. Let's unmute you. You can unmute Rachel. Hey, that's really Deborah. It's their daughter. They like to use our Zoom for whatever reason.
Wait, where am I?
That was Gary's.
Rachel?
Yeah, that's Deborah, though. But name is Rachel. There you go, Deb.
Deborah, hi.
Hi. Yes,
Hi,
but
what's up?
we don't know how to change the name. So,
Very
okay.
good.
So we've been doing a lot of walking, right? I walk a lot.
Correct.
So about, I would say like a half a mile to 3/4 of a mile in, my lower back so tight. So what am I doing wrong? Because it's just walking.
Yeah. Well,
Gary's causing you so much stress that it goes all to your low back.
I see a middle finger down there somewhere. So I know it's just walking, but the thing about it is, don't forget, it's probably more volume of walking maybe than you've done. So it does matter a little bit. A couple things. Remember, walking is an extended activity where you're upright this way. And so there's probably what's happening is your lower back is starting to take over for potentially your glutes or your core. I would say getting into some of these laying down positions with your feet up to try to get core engaged, and then even doing some glute stretching or some hip flexor stretching. Last week, we went over like a couch stretch where you put your foot up on a couch and you open up your hip this way to feel like you're stretching the front of your thigh, just to get the front muscles opened up a little bit and the glutes working a little bit. So probably that's around what's happening, but you want to make sure you're getting the front of your body nice and open so that your back and your glutes can do what they're supposed to. Usually what I tell people, it's kind of the same when you're lifting weights. You've got the back muscles and you've got the glute muscles, and one of them is going to win. And if your back always hurts when you're walking, probably your back muscles are winning right now. So if we can get you in an exercise, potentially like a glute bridge or something along those lines, where you're feeling your glutes and not your lower back, that's like probably your sweet spot right now.
Okay.
But if you're exercising and you're doing bridging and you're doing a lot of stuff and your low back is bothering you, I would just don't keep progressing with that, because it's not just gonna work itself out. You need to make sure that we're doing exercises that don't hurt, that you feel appropriately, so you're training your body to feel what it's supposed to feel, rather than just always kind of going in, oh, another workout, my back hurts, blah, blah, blah. So I'd want to make sure that we're able to do some of that stuff.
Should we do those stretches? You're saying like hip flexor stretches and stuff, and maybe like glute activation before one goes for a walk, or okay?
Before, yeah. So before for sure. And even again, some muscle activation. I don't know that it's going to work 100% of the time. Generally though, this is what we see. So getting hip flexors opened up, getting glutes activated a little bit, maybe that just gets your glutes working a bit more rather than your lower back. Kind of the same idea we were talking with Lisa about the golf and tennis stuff. What are we trying to do? We're trying to get the core engaged, and we're trying to get the hips and glutes working so that it takes pressure off of the lower back and the shoulder, what are the common culprits in the rotational sports. So think about a warm-up before you do an activity as like muscle activation. You're just kind of trying to get the system fired up a little bit. And it doesn't have to be a lot. It could be 5 or 6 minutes of activity just to kind of get yourself ready to go. So not a terrible idea. And then also afterwards, taking 5 or 10 minutes to roll out or do 5 minutes of cool down or stretching can make a world of a difference. World of a difference. Mark said after last week he altered the way he was doing squats and it was very helpful. Well, thank you. I appreciate you saying that.
Meg, that's you?
Oh, Meg. And you have a sweet background, so you get extra points. All right. What else? Who else has questions? Anybody else? We good? Rob, any last questions?
No, I think that's pretty good. Oh, Gary unmuted himself. What do you want to say, Gary?
I have nothing to say except for remember the time that you threw my back out? We should tell the doctor about that.
Doctor, could you mute Gary, please?
Rachel, how's that stretch? Is that hard?
It is, but I feel it up in here, like closer to my hip, like what I would call my hips. Like I feel it in here.
You should.
Oh, I thought I was supposed to feel it here.
Well, either or. Yeah, either or. So just to show you guys that couch stretch, if anybody wants to do it at home. So basically the closer you get your heel to your butt, the harder it is. So if you can see, you see this here. So if you want to make it a little easier, you just kind of lean forward a little bit and you can feel it in the hip. If that's easy for you, watch what I'm going to do. I'm going to go back up and bring my butt to my heel. Now
I feel it.
Talked about we're not allowed to arch our back, so I don't want to see this crap, right? Abs engaged, core, glutes engaged. I'm upright and I'm feeling this stretch. I'm not doing this. So if it's challenging for you, just move your leg out, lean forward, and just push your glute a little bit. See how I'm squeezing my glute? If that's easy, come back up tall. But that's a really good one, especially for you golfers. That's one of my post-golf stretches. My two post-round stretches are that one, and then just some nice, easy back bends, just because we're stuck here all the time. What else? Anybody have any other questions? You guys are good?
Yep, that's great.
Perfect. Excellent. Well, I appreciate you guys coming on.
Thank you, good doctor.
And Rob, do me a favor. If any of you guys need anything, Rob, can you just shoot them my email and just, you guys can shoot me an email. Hey, can you send me this? Can you show me this? We have a lot on our YouTube channel, a lot of our social channels. So all information for you guys, free on there. So, utilize us as you can, and potentially maybe Rob will even have me back again to do something else if he foresees he needs someone as charming as me, right, Rob?
Yeah, sure.
Right.
He is actually very charming.
What can I say? Don't ask my wife. Does she think I'm charming? Not at all. All right, guys. Thank you so much. I'm going to play golf now too.
Go for a walk, everybody. Put some sunblock on. It's hot outside.
Bye, guys. Have a great weekend.
Not used to it. Gary, put it on the top of your head too.